The most important thing that I can say is that it starts with knowledge. It may seem vague, but that's the most important thing when it comes to preventing a heart attack, preventing heart disease. It comes with knowledge. So what does that mean exactly? The first one is there's a lot of things that's going on in your body that you may have no idea because you don't have any symptoms of it. Unfortunately, that is why hypertension is known as a silent killer. A lot of times people don't even know that they have high blood pressure until they've had an event such as a heart attack. So it's important for us to know now whether we do, so we can prevent the blood pressure from becoming worse and then over time, decades, leading to a heart attack or heart failure or stroke. So if you don't have any symptoms, how do we know? Routine follow-ups is going to be the biggest recommendations. Seeing your primary care provider at least once a year to better serve you, better serve your family, and make sure that you're not at risk. And if you're not able to go to your primary care yearly, the one thing you should have is a blood pressure machine at home so you're able to check this. It doesn't have to be the most fanciest one, but get a good one. There's some links in the description about which ones that I took so that you can know that you don't have high blood pressure, number one. And then number two, you could have something called white coat hypertension, meaning that whenever you come to the hospital or whenever you come to the office and get your blood checked by someone like me or someone with a white coat, you get higher blood pressures compared to when you're checking it at home and it's always normal. Because what we don't want to do is treat you for high blood pressure when you don't have it. What's the best way? To have your own machine where you can check it routinely. You can even bring it to the office and we can check it side by side to make sure that there's no issues with your machine and also there's no issues with our machine. Well, what else do we look for to prevent heart disease? First, we have to look at what are the risk factors. In addition to hypertension, we have to think about a strong family history, especially if someone died unexpectedly, died at a young age, or had heart disease, heart attack, heart failure at an extremely young age. Males 55 or under, women 65 or under. High cholesterol, especially if the LDL is greater than 190, you may have a genetic predisposition to having high cholesterol, which is a risk factor for heart disease. Diabetes, elevated blood sugars. If you do have this and it's not under control, recommending for you to go and see your primary care, go and see your endocrinologist if it needs more attention to get you into that 6.4 or below range, or potentially getting you to the point where you do not have diabetes anymore. Of course, I'm talking about the type 2 diabetics. Weight loss, weight management, nutrition selection encompasses that all into one. Just knowing that adequate weight loss, watching what you're eating, Mediterranean diet or the DASH diet is recommended, where it focuses on fruits, vegetables, decreases the amount of red meat and processed foods. Sleep and stress. Understanding that inadequate sleep, increase in stress are risk factors for heart disease and also risk factors for poor health in general. So all of this starts with you just having knowledge of this and then asking your family too. Did something happen to someone in our family where they passed away unexpectedly or had some bad news at a young age? Because we can take all of these information and make a good treatment plan for you, whether that's just lifestyle modifications or modifications plus some medical therapies. My name is Dr. Isang. If you find any benefit in this, hit that subscribe button. Thank you.